Professor Nadav Davidovich, chair of the Israel Public Health Physicians Association, speaking to us from Tel Aviv. And Nadav, of course, Prime Minister Bennett, and he said this, has to take many factors into account, including economic factors. But from the health perspective, given the fact that we've seen now this new Delta variant emerge abroad, is it the right thing to do to allow individual foreign tourists back into Israel at this time?
So I think yes, because we are going to see more and more variants. These specific variants we are following all around the globe. There are now about 8% of new cases every day in the UK. It's quite similar to the Delta variant with two more mutation. There is no indication for now that there is a difference in terms of vaccine efficacy. Maybe it's spreading a bit faster, but it still needs to be checked, and no sign that the clinical symptoms are worse. So, of course, we need to be very alert, and we need to continue as we're doing in the last few months, doing the genetic typing of the different viruses. In April to July, unfortunately, we let the Delta variant entering, but we cannot, like with schools, we cannot close the skies forever. Other countries, including in Europe, are allowing tourists to enter that are vaccinated, and I think this is a balanced and prudent way, but we must enforce all of the measures, including isolation when needed, PCR tests, and genetic typing.
Right. Now, it's an interesting coincidence that Prime Minister Bennett is meeting Vladimir Putin tomorrow, because there had been reports that maybe Israel would authorize entry of those vaccinated with the Sputnik vaccine. That apparently has been, at the very least, delayed for now. Reports that a decision may be made towards December 1st. Where does the health establishment stand? Do they see Sputnik as reliable or not at this stage?
So I think we need to stay away from politics regarding the approval of different vaccines. We are working together with the WHO, with the World Health Organization. We moved now that vaccines that are approved by WHO are also approved by Israel. And I think that we need much more information in order to understand better the efficacy and safety. We need to leave it for the professional discussions, and I think we should be very careful, because there might be erosion of trust by the public. And here, I think working together with WHO and the international community, being transparent about data is very important.
Right. Now, I want to ask this question, and it's kind of relevant because there was a new test study today that showed for minors on the age of 18 for teens that have gotten the Pfizer vaccine, something was at 90% efficacy. There is the issue of children from abroad who have not yet been vaccinated. You know, a lot of families are going to want to come here, even with young children, especially Jewish families for the holidays. What's your view on how that should be handled at this stage? Should Israel simply bar unvaccinated children?
We are talking about a system that is a bit similar to the Green Pass. So there is the option of being tested. And again, this is not a punishment. It's in order to keep the environment as safe as possible in a proportionate way. So we're talking about those who are vaccinated, but also the options being tested depending other PCR, and then you can do it every few days or every day with rapid tests. And I think indeed that this is a prudent way of doing this. We are following what other countries also are doing. We cannot close the skies forever. And now that we have vaccines, we have testing, and we can do the genetic typing, the main problem would be enforcement, surveillance, and follow-up, I think, and also working together with other countries and exchanging data is something that was not so good in previous months.
Right. That could be enforcement and monitoring of tourists cannot always be